Genetic counseling is a process where we identify patients who would be high likelihood to have an abnormality in their DNA that would increase their risk of developing cancer. When the patient comes in for the genetic counseling, we'll review their history, talk about different things that are pertinent to genetic testing, what the process is like, and then discuss whether or not they'd like to move forward with testing.
Patients can be referred by a physician, or they can even refer themselves if they have a heavy family history of cancers such as prostate cancer, ovarian cancer, breast cancer, pancreatic or colon cancer, even melanomas, if it's heavy enough in the family, would qualify them for testing. We're not just here for patients that have cancer, we're also here to prevent cancer.
Once a patient says yes to testing, we obtain a specimen from them, and that can be either from blood or from saliva, and then that's sent off to the laboratory. The process typically takes about a month from start to finish. Once they come back in, we sit down and go over the results, talk about the implications of those results, positive results or negative results. That way we can formulate a plan that's appropriate for that patient.
There are a variety of genes that we test for, in fact 36 total in a full panel test. So I really stress to the patient that even if they might not have an interest about knowing if they have a genetic mutation, it's really important for their family members to know so that they can get plugged into early detection programs.
Once we get the results, we can look at the specifics of it and determine whether or not the patient has a genetic mutation, and then we take it and make a specialized follow-up plan for that patient and recommend what screenings they should have done. Also, we can do that for patients who do not have a mutation, but because of their personal and family history, it increases their risk of developing cancer in general. It's so incredibly helpful because patients are being diagnosed with cancer more frequently, and if you can identify those patients that are high risk sooner rather than later, you can not only find cancers earlier, but there are instances where we can prevent cancer.